There is positive news for St. Louis in the coronavirus fight, but there are issues statewide. Good evening. Thank you for joining us. I'm Steve Savard.
I'm Samantha Jones. Those problems are rapidly growing case numbers outside of the metro. Tonight, Missouri is reporting its largest ever one-day total of new COVID-19 cases at 553. And with that number, the state is nearing the 20,000 mark.
And right now, investigators from the CDC are preparing to visit Missouri. They'll be focusing on case increases in southwest Missouri. Corey Stark is at Barnes Jewish Hospital tonight looking at other new data and concerns from regional doctors.
Yeah, Steve, new models show the biggest increases that we are seeing in the state of Missouri are from rural counties across the state, which is opposite from what we saw before when most cases were in metro areas. As far as our viewing area goes, St. Francis County has seen a 90% increase in cases just in the last 7 days. That's according to state data. And as more cases rise, so does the potential for more people to be treated at St. Louis area hospitals. Today in the St. Louis region, the number of COVID-19 patients in the ICU down, and the people on ventilators are down. These numbers have a 2-day lag, but right now this is positive news. But as other areas see increases, we're reminded we're all in this together.
Our hospital systems within our jurisdiction really serve individuals beyond the St. Louis metropolitan area. And so this has the potential to trickle over into the St. Louis region, impacting hospital services.
Dr. Frederick Eccles, the director of health in St. Louis, says what St. Louis did early on is paying off.
A really conservative approach to implementing mitigation strategies, because we either would pay for it on the front end or pay for it on the back end.
But it's not all good news. The city of St. Louis has seen a 178% increase in cases of people between 10 and 19 years old over the last month. Dr. Eccles says that's partly because of available testing and younger people not following proper guidelines. That's a concern for all age groups.
My big worry is that we're starting to think that we're safe right now when we're not. We sort of have this smoldering fire that's just waiting for some dry wood to be thrown on top of it so it can flame up again.
The fire is already burning in places like Oklahoma, California, and Texas. With an immense surge in cases tonight, Texas Governor Greg Abbott putting a halt to the state's next reopening phase. Texas hospitals are running out of space for patients.
We're watching things outside of the city of St. Louis very closely as well, because it's only a matter of time before, there could be another wave of cases in our city.
Again, the trend we are seeing here in the St. Louis region is positive as we're seeing fewer hospitalizations. But I was reminded many times by health experts tonight that those trends can change very quickly, especially as we all get out and start to do normal things that we all do in life. So the important thing here is to keep following those guidelines that are in place. For Live Tonight, Corey Stark, News 4.